Okay, so I'll be presenting my thesis
Oh,
topic
just let
on
me introduce you, Lindsay. Just
yes.
wanted to say welcome to everybody, and we're happy for those of you who are here right now, but happy for those of you who are going to be recording later. And yes, introducing Lindsay Tascona, one of our master students, and she is working with Dr. Sheri Price, her supervisor, and both of them will be presenting today. And yeah, just really happy that you're here. So I'm going to turn it over to you, Lindsay and Sheri.
Perfect. So my name is Lindsay Tascona, and I'm in my second year of the Master's of Nursing program, and I'm going to be presenting my topic on novice nurses in charge nurse positions. So right now I'm still in the proposal stage, so I'm just kind of going to be presenting my emerging ideas on the topic, and any suggestions would be great. So I'll provide you some background on the issue. So in the acute care setting, novice nurses are now assuming leadership positions such as the charge nurse role at earlier stages in their careers. So the charge nurse role is a formal leadership position that involves managing frontline staff and overseeing care delivery of an assigned nursing unit. So strong leadership at the charge nurse level can positively influence nurse retention, patient outcomes, unit safety, nurse productivity, and quality of care. So it's a very important role in the acute care setting. So despite the positive benefits that this population position can have on organizational outcomes, there's often minimal training or competency development offered to nurses transitioning into the charge nurse role. So historically, senior nurses were primarily placed in this role due to their vast clinical experience and knowledge. But currently, the number of senior nurses present, there's a variety of reasons for this shift in demographics, such as high employee turnover in hospital settings, early retirements, and increased job flexibility within the nursing profession. So on floors with high turnover and poor staffing ratios, it may be a reality that a novice nurse is placed in the charge nurse role on a permanent basis. So novice nurses are especially vulnerable to experiencing burnout the first 3 years after graduation. Burnout is associated with high turnover rates, absenteeism, reduced productivity, and can have a negative impact on a nurse's psychological health. So the purpose of this study is to explore the experiences of novice nurses with 1 to 3 years of experience in the charge nurse role. So this particular experience range is the population of interest, as they're more likely to be placed in the charge nurse role on a permanent basis than a new graduate nurse. So the significance of this study, there's a large gap in the literature about the experiences that novice nurses are having in the charge nurse role. So novice nurses may have unique experiences compared to more senior nurses in this role. So it's important to understand their experiences so that resources and supports can be developed so they can be supported on an organizational level. Developing supports and resources that are tailored to their unique needs could promote retention within the profession. This study also hopes to draw attention to the need for future research in this area. So the research question that I've developed so far is, what are the experiences of novice nurses in the charge nurse role? And I haven't written the literature review yet, so I'm just going to be discussing some ideas that I'll be going over. So I'll be discussing Benner's novice to expert theory, just because the nurses with 1 to 3 years of experience, they're not brand new nurses, but they're also not expert level yet. So it'd be interesting to look at where they lie within that theory. And I also think it will be important to mention that one's years of experience does not always equate to one's leadership abilities. So for example, just because a nurse might be an expert in one area does not always equate to them having strong leadership abilities. And then I'll also be discussing the charge nurse role and the literature around their responsibilities, as well as discussing the leadership development aspect. So the literature has highlighted how providing leadership opportunities and supports for charge nurses in this role have been found to improve their skills required for this role. And then I'll also be discussing new graduate leadership, because there is very minimal research conducted for nurses with 1 to 3 years of experience. So I'll be discussing the literature around leadership development in new graduates and how, when it's implemented early in one's career, it can have a positive impact on one's practice. And so a narrative inquiry approach will be used as a methodology to guide this study to help better understand the narratives, feelings, challenges, and experiences that this population of nurses have in this role. So narrative inquiry is a qualitative methodology that seeks to understand and represent real-life experiences through the stories of the research participants. So it uses storytelling as a way to communicate the experiences of participants to larger audiences. It's interpretive, and there are various narrative inquirers that have had a large influence on the narrative paradigm. So this study will be focusing on the framework developed by Clendenin and Connolly. So the main concepts in this framework are the concept of temporality, sociality, and spatiality. So the temporality aspect refers to the past, present, and future. So it emphasizes that every event, person, and institution have a past, present, and future. So these life experiences can be considered to be on a continuum. So when considering novice nurses in the charge nurse position, each person's past, present, and future need to be considered to fully understand their experience as a whole. And then the sociality aspect refers to the personal and the social. So it discusses, the personal refers to the internal conditions of the participant, such as their personal feelings, hopes, and identities. And the social refers to outside influences that may be impacting their experience. So when considering this population, it may be different influences of different physicians, other nurses, or managers that may be impacting their experience. And the spatiality aspect looks at the place in the environment. So the framework suggests that each place an inquiry takes place has an impact on the experience. So for example, the work environment of the participant could have a large impact on their experience. So for example, if their designated nursing unit has high acuity or poor staffing, it could be impacting their experience as a whole. And so this sample population would ideally consist of 3 to 5 participants, and the inclusion criteria would include being a registered nurse with at least 1 to 3 years of experience acting as permanent charge nurse. So the small sample size is ideal for a narrative inquiry because they're often performed on a small number of participants. So it provides a richer narrative to the experiences of the participants. And the data will be collected using semi-structured interviews. Ideally, 2 interviews would occur at 2 different time periods, contributing to that temporality aspect of narrative inquiry. And so the data is planned to be analyzed using Polkinghorne's theory of implotment. So I'll just provide an overview of how the data is planned to be analyzed. So first, I'd re-listen to the interviews to gain a more holistic understanding of the participants' experiences, and then the data will be analyzed using that 3-dimensional narrative inquiry space, considering the temporality, sociality, and contextual piece. Then initial themes, plots, and subplots would then be developed, and the data would be regularly returned to make sure that all the key ideas were identified and to gain a better understanding of the meaning behind the participants' stories. And then the initial themes, plots, and subplots would be member checked with each participant to validate the findings, and all the participants' theory stories will be compared and contrasted to identify any similarities and differences. And then finally, final themes, concepts, and plots would all be synthesized and developed into an integrated whole, revealing insight into the experiences that novice nurses have in charge nurse positions. So the use of narrative inquiry as a methodology guiding the study will provide a narrative to the experiences of novice nurses in charge nurse positions. So it hopes to give a voice to nurses taking on leadership roles at earlier stages in their careers that may have otherwise remained silent, and hopes to promote change in practice through telling stories. These are my references.
Thank you, Lindsay. I'm seeing some of this for the first time as her supervisor, because I know it was in Megan's course you had the opportunity to write a research proposal. Is that right, Lindsay?
Yes.
Yes. So we welcome everyone's feedback or questions, if anyone has any. Great job, Lindsay. Shelley has a question.
I have a couple of questions. Very interesting, and I think it's really going to add not only to the body of knowledge for new nurses, but for curriculum development as well. But my question is around Benner's novice to expert. You said you were interviewing 3 to 5 people. How will you classify them based upon, how will you decide if they're novice or an advanced beginner or a competent, proficient? Which level? Kind of, because there's lots of discrepancies in the literature as to how to classify people. So I was just curious if you thought about that.
I haven't thought about that yet, but part of the aspect of like the novice nurse, I feel like I'm more so going to lead towards like the early career nurse, because I think that they're like, some might be advanced beginner and then some might be, I forget what the one after that is, but advanced beginner to competent. So I feel like they would more so be within that range. So I guess interviewing or asking about their experiences that they have had so far as an RN would help classify that a little bit better.
Yeah, I think that's going to be a challenge, Lindsay. And maybe that's a real area to find. I don't mean to put you on the spot, but that might be a really good area to focus on to make sure you're clear on those variables and how you're going to classify people in that, because most nurses you talk to within their first year, they will say they're competent, and they will say they may even be proficient, even though it doesn't fit their theory. So that was just my only comment.
Yeah, no, thank you, Shelley. I mean, these are things that we're teasing out, but Lindsay and I have talked about that very fact. We're not going to use Benner's taxonomy to necessarily be defining. I mean, it's an area in her research that obviously she wants to touch on because she's using that word novice. And you can't talk about novice nurses without referencing Benner. In terms of how she might what she might use in regards to her sample might be might draw on some of that, but you're absolutely right. We don't want to necessarily have the nurses self-identify with being in one of those stages of Benner's work. So we've talked about early career, saying within 2 years of practice. We're also hoping to just find out from the practice sector, what is that range that they would, they wouldn't have a new grad 6 months out in a charge nurse position, or would they? So trying to get a sense for also making sure that Lindsay gets a sample. So we don't want to put parameters on it that no one's going to fit within. So that's really helpful. And I think that as she develops the proposal and builds a committee, that's one of the things we're really going to talk about.
Sheri, because I mean, I've been a nurse 30 plus years, but if I went back to labor and delivery, I would again be a novice.
Yeah.
It's really not on time. So can't wait to hear the results of this one. Thanks.
Thank you.
Yeah, and I think that that's absolutely why we don't necessarily want to use the parameters as they apply, because it's not clear cut. And I know in my own work, I've cautioned against using Benner's just for the reasons you said, I mean, so much plays into what is experience and what is our own assessment of our experience. So that's really helpful, Shelley. Thank you.
I do have a quick question, but I'll go to the audience first to see if others have comments or questions.
I think it's just you, Megs.
Yep, okay, just think about that. Yeah, so, exciting, really important research, Lindsay. I would just like you to talk a little bit more about your passion and why you want to do this research, how it came about, and
Yeah. So I think this research, when I entered grad school, Sheri and I had a conversation and she kind of was like, what brought you to do this degree and where do you work? Like, tell me more about you. And the place that I worked at the time was a floor with a lot of high acuity and a lot of nurse turnover. So I was like regularly placed in the charge nurse role at an early stage in my career, not on a permanent basis, but I do know that there were nurses placed in the charge nurse role on a permanent basis with the same amount of experience that I had. So once I left that floor, I kind of just thought it was my floor, but when I talked to other nurses in the acute care setting, in like the VG, it's happening on every floor now. Like the floor nursing is just so young. So these new nurses are being placed in these roles at earlier stages in their career. So I guess just like my passion is just like providing support, because I think floor nursing is so important to your career, but I think there is starting to be a lot of nurse turnover in that area because it is, you don't always have that senior nurse support that there was in the past.
Yeah, and I've certainly lately heard anecdotal notes from new grads across Canada, just, and you think, oh my goodness, like, why does that happen? How does that happen? How do you feel? And I know their perspectives are anxious and like, this isn't appropriate. And some of the stories that I've heard, where other maybe stories are like, yeah, I'm really keen to do this. I'm ready. So it'll be so interesting to see, the variety, but I think a lot of it is angst that I certainly hear. And then you just think, well, the institutional structures and the environment. And so, yeah, the complexity of narrative and what you're doing, I think will really bring out a lot of these stories.
Mm-hmm. I'm excited, but nervous to get a sample, I guess, because it's hard to know who will be recruited, I guess, or who'll be interested.
Yeah, and I think that there's so many things about your question, Lindsay, that we don't understand. Like, what does charge nurse mean? And how do people conceptualize that? And Megan and I do a lot of research around the words we use and the titles and what does charge nurse, how is it constructed? And what do we think about that position? And I think historically, Megan and I and Sheri, because that's all I can see right now in my gallery, we can tell you that I remember the charge nurse was the person that was there the longest, who was the most experienced by number of years. But then we look at our evolved understanding of leadership and being a charge nurse is a formal leadership position. So even though it's a temporary formal leadership position, because you're not like the charge nurse forever, you're the charge nurse maybe for that shift, I think that we also need to understand the context of what it means to be in that role. I remember one night everybody seemed to be sick, and I was a relatively new grad in an ICU, which is a very high acuity area. And I went to a hospital where they weren't used to seeing new grads because it wasn't a teaching hospital. So they basically didn't think I belonged even in the ICU working. And a lot of people were sick, or there was a snowstorm. It was in Moncton, so it was probably a snowstorm. And people were sick of the snow. And I was a charge nurse because we had float nurses come in. And you wouldn't believe the look on everyone's face the next morning when the snow cleared and the roads were plowed and the staff came on and they realized I had been in charge. And that understanding of the context is so important as well, because it made me feel like I felt really good the night I was in charge, but I felt really bad the way I was received the next morning. So there are those factors outside of ourselves as well. But I know that it really boosted my confidence because someone needed to be in charge. And, what it meant was, in the context of that unit, was that I knew the patients, I knew the unit, I knew the staff, so, what did it mean if I was there 20 years or if I had just been there a year? So I think there's so much to tease out there. And I think that we haven't written about it, but as you mentioned and so beautifully articulated, it is so relevant right now when we have a population who is retiring and we have new graduates coming in, which could be another term that you use. So new graduates, how do we define that? Who are coming into these areas, and they are the areas where no one comes to stay. They go in and they go out, probably in 2 years. So those unit managers usually know that their turnover is really high, and they're basically a placeholder for students to get some experience and move on. So, I think you're going to find maybe that your sample comes from those areas. So maybe thinking about with your committee, who are some of those nurse leaders that might be able to help us understand that sample so that we can help further define it, as Sheri said.
That's a good point.
Can I ask another question?
Yeah.
I'm just curious if you're going to look at any differences with urban and rural, or will this be totally urban? And I asked that, I'm situated at the campus in Yarmouth, and sometimes our new grads are under a year that they're in this charge nurse role. So I wonder if there are more opportunities if you have if you don't limit to urban, and maybe you're not limiting to urban.
So far, not limiting, because I just don't know how many participants are in these positions yet, but I know for sure there are some in urban, but I'm definitely, there's no limitations so far, because I think that's an interesting point. I just, in my position, have never worked in a rural area, so I don't know what's kind of going on there as well.
You know, and even at times, Lindsay, some of the students, some of the new grads, sorry, are in charge nurse roles on units that they might only be floating to. So once again, I really think that this research is going to be phenomenal to uncover some of those nuances that are there in the system and help guide us. Thanks again.
That's a really good point, Shelley, because there is an opportunity here to maybe be specific that we're doing rural or urban. I think that because the sample is so small, to do both and be able to say anything about either in a significant way probably would be lessened because of the sample size. So that's something that I think maybe we'll have a subsequent conversation with you and other, like we want to really understand where we're going to get the sample. And I think that Lindsay can shape our study for that. And then we can tell the story that might be a little bit more fulsome if we are focused. Yeah, but I mean, at the end of the day, we're also wanting just to get Lindsay graduated. So, yeah. So does anyone have any other questions before we move to our second presentation? Lindsay, you did a great job.
Sydney had a comment in the...
Yeah, thank you, Sydney. That was a great comment. It's very well received. And I love to hear that, you know, you've also heard stories from fellow nurses. So I think that it's helpful for us to hear that from someone who's, you know, earlier in their career. And, you know, so we'd love any input you have if you want to even direct message Lindsay after. Yeah. Thank you, Sydney. Awesome. So our second presentation, which I'm going to let Lindsay lead as well, because it's sort of, it's her story, but I will give a little bit of a backdrop to it. This is something that Megan Aston and I do a lot of, I believe, innovative KT. And what I've realized is that whenever we go to do something kind of fun, we go to the literature, as all good researchers do, and we can't find a lot of information or direction on how to do it. So I started saying, why don't we write about how to do it? And then other people might know how to also do it. So take the research findings and not just write a publication, but say, like, what do my research findings allude to in terms of what should be happening? And let's say some of our research has indicated that we need to increase awareness about issues. And if we need to increase awareness, well, how do we do that in the context of today? So using social media, using videos, how do we take our research findings and actually make a video? It sounds so easy, especially in the era of TikTok, but it actually is much more difficult than that. But Lindsay did not have her first publication. And because Megan and I have been so successful in writing everything basically down to our chocolate chip cookie recipe, we've published almost everything we say. So I thought, why not throw this ball to Lindsay and say, Lindsay, here's your first paper. And everybody, applause for Lindsay. This is her first publication as first author. So she wrote a how to do innovative KT by interviewing myself and a co-investigator on one of my studies that I lead. And she's going to walk you through that experience. I know, what a great accomplishment. Way to go, Linz.
Yeah, so like Sheri was saying, this presentation developed from an article that was published which overviewed the process involved in producing a video as a KT strategy to respond to and address findings from research that she conducted on professional socialization experiences of physiotherapy students. So just going to provide you an overview of the presentation. So just going over how to get involved in supervisor research, and then we'll provide some background on the study, the article development, the writing process, and finding the right journal. So I was interested in getting involved in Sheri's research, but there wasn't any active studies going on. So Sheri had an idea to get involved by writing an article about the how-to process about the KT video production that was created to disseminate her research findings. So just to provide some background of the research study, the research study explored the process of professional identity development and the views of interprofessional practice of physiotherapy students in the first year of their program. So the main findings were that the prospective physiotherapy students held stereotypical views that physiotherapy practice involved mostly working with athletes and people with orthopedic conditions. So this led to role uncertainty and confusion during their first term of the study. And the main findings were disseminated by creating a video that captured the vast scope of physiotherapy.
Yeah, I just want to interject. Great job, Lindsay. Just because I was the PI in the study, when we say that, we probably think, well, what's the big deal? But the attrition rate from physiotherapy was really high. We had all these students basically thinking that being a physiotherapist meant caring for athletes caring for athletes in sports-related injuries. And given that the predominant focus really of physiotherapy practice within tertiary care is feral elderly outside of like a pediatric center, it's rather problematic. Students would get to their first, because physiotherapy is a 2-year program, they learn a lot fast. And in the first semester, they were given a stethoscope and they had no idea what it had to do with being a physiotherapist. And they were really shocked to know that they really had to even learn about the lungs and the heart. So there was such a shock. I mean, we're all shocked. It doesn't matter what program we're in, but physiotherapy students of all the 5 cohorts we studied, which was nurses, dentists, physicians, pharmacists, and physiotherapists, the physiotherapists were the most shocked. So our findings were shocking. We thought there's got to be a better way to help these kids know what they've signed up for.
So to develop the article, we first conducted a literature review and noticed that there was a large gap in the literature discussing the how-to process of using arts-based methods such as video. So interestingly, the most widely used art genre is photography, followed by theater, with relatively little use of video, which is interesting because media and internet is so often used in our society. However, it still remains a very underutilized KT strategy. So the next thing we did was kind of review papers that were written about similar topics to determine how to best present that information. And then because I wasn't there for the study or the video production, I came up with some questions and interviewed both Sheri and Catherine to better understand how they developed the video. And then the first draft was developed, which included a section about the production process, the challenges that they faced with the production, and the impact that the video had. And then while I was writing that, again, I wasn't there for any of the video production, so I frequently checked back in with Sheri and Catherine to clarify some aspects of the video. And after the first draft, we included a section about a guiding KT framework that was followed during video production. So it was the guiding framework by Gagnon, which helped ensure that the dissemination tool remained evidence-based and scholarly. So this framework helped with publication. And the framework discusses, 1, the message, who's the audience, the messenger, the method being used, and the outcome. And then the article was revised several times by all authors until a final copy was developed. So finding a journal for this article was a little bit challenging just because it wasn't based on research findings, but rather the dissemination strategy. So it took a little bit of time to kind of look at the aims and scopes of different articles, and we finally found a journal that was focused on education and medical sciences, and it was accepted for publication. And just wanted to highlight the evaluation piece. So it's an important aspect to consider in any dissemination tool. And it it enabled us to evaluate the impact that the dissemination tool had. So our desired outcome was to increase awareness of the scope of physiotherapy to protect prospective students. So in September 2021, we'll be conducting a survey for incoming physiotherapy students to measure their understanding and views of physiotherapy practice. So this was an aspect that really needed to be highlighted in our publication, just to kind of measure what's happening with your KT strategy and having an idea of what your impact, what you want your impact to be. I don't know if Sheri, you have anything to add on that?
Yeah, no, I just think that it's getting harder and harder to publish first, thank you, Lindsay, that's a great job. And it's a great introduction to students, for those faculty members who have students working with them, to get their feet wet and to publish something that it doesn't need their data, which is only going to come in a couple of years. But it was a way to get Lindsay involved in our research, which was active, and there were studies that she could have jumped onto, but really her focus is her own work. So I've been really cognizant as a supervisor to not pull Lindsay away from her own ideas to embed her in my research until she feels that she's able to do that. And so this was a way to give her just a small paper that had a big impact. And also, I think we don't recognize all those opportunities to publish different parts of our work. We sometimes just think, well, there's findings are the only story. But so much of my research has been, what do I do with the findings? So I figure if I'm going to publish and present about the findings, and most of what I do with my research is the responsiveness to the findings, then I should give some equal airtime to that aspect as well. But as Lindsay said, it's hard to find a home for that. And we have to keep trying, though, because I think we have, there's an ebb and a flow to what gets published. And, there was a time when it was really difficult to publish qualitative work or small studies or small sample sizes. And now I think that isn't an issue. So I think we do, in the context of KT, have to push a little bit to get journals exposed to articles such as this, which are really helpful to researchers to see what they can do in an innovative way. But they do need to be scholarly. You can't just write up, hey, we made a video. They want to see that there was a structure, that there was a framework, that there were evaluative methods. So those were all things that Lindsay contributed to the article. So the article wasn't just her telling our story, but her telling a story of what we did. So, and it might sound like that's the same thing, but it is very different, because that's how Lindsay can be first author on this, is she told a unique story by taking our work and actually disseminating our dissemination. Yeah, that was going to be the title of this presentation, dissemination. Does anyone have any questions or comments? No.
I do. You knew I would, Sheri. So here's my question. My question is, when are you going to make a video of this article to disseminate to people?
Yeah, we actually should. One thing, Lindsay wasn't on site for this, but Megan has been. And I remember the first time I did a video with Megan, she was like, oh my gosh, this is intense. Like, I was laying on the floor and I was laying on stretchers and I was saying for people to smile at me. And I was like, what you just said, say it again. Because, it is so beautiful, yet maybe they scratch their nose. And so we're not a big production company. It's not Hollywood here. We have small funds, but we do large things with it. But if you go and watch the physiotherapy video, you can see that the quality of that is much higher than any of my other videos. And that's because we didn't use Sheri and Megan's iPhone. We actually we had a little bit more money and we hired a production company. But working with a production company, we should have videotaped it, because I found it was really interesting. They insisted on being the ones to interview, to draw out the messages. We never script our videos. We never use, okay, so when we say we never use actors, we kind of use actors, but they are actually real nurses or real physiotherapists. They weren't research participants, but they resonate with the findings, their stories. So it's easy for me to talk about being a nurse if I am a nurse. So we get physiotherapists to actually tell us about their studies, but the production company insisted on interviewing the people. And that was really difficult for me because I know what I want them to say because I know the research findings. I know what they have said. And we spoke to this one gentleman who worked in ICU. His name is Doug, and he is a physiotherapist, and he helps people who are on ventilators, either trached or intubated, walk. And he said this line, and the guy from the production company didn't know to get it out of him, but I did because I'm an ICU nurse. So I said, Doug, you help people walk who aren't even breathing on their own. And he's like, I do. And I'm like, say that. So it wasn't a lie. And I didn't really feed him a line, but the production company guy would have never gotten that out of him. So I think that there's a lot that we do need to share about how do you make sure the quality of the work is in our control. And we're the researchers, but we're also the health professionals, and we also understand the context. Like Megan's a public health nurse. She understands the context of that. So she can say, oh, wait a second, this would never happen. Even when it came to rebranding the School of Nursing and getting new photos, Shelley, this is really interesting. The photographers wanted to have the stretcher be pushed down the hallway in a way that the nurses and the patient were looking at the photo or the photographer. And I'm like, no, a nurse never pushes a stretcher of somebody who's critically ill looking away from the patient. You're always looking at the patient. But they didn't know that. So, if we're going to do these things, we have to make sure we do them right. And sometimes we don't even know what's going to come up. Like you don't know what you don't know. So that's a really good point. I think that everything we do for the first time is a learning. So I've learned a lot through this. And I think I've done 12 videos now. So now I get a better understanding of how to do it. And I also know that your iPhone isn't as good as a professional.
Thanks, Sheri. That's very insightful. I certainly know the school and the undergraduate program now we're producing our own CanSim virtual games online and using the GoPro technology, which is extremely realistic because it captures exactly what the nurse is seeing through her eyes for those. So, no, great. Can you put the citation for the article up and what journal so we can take a look at it?
Yeah, it's just been accepted. So I think we had the page proofs and Lindsay just submitted them, the queries. So we'll have actually a link and we'll send that out and we'll make sure that Julie sends it out.
Great, yeah. Thanks. Thank you, Lindsay. Well done.
Thank you.
Does anyone else have any other questions? We have a small audience today, but we're not going to take that personally, Lindsay. It's February.
Jump in, anyone.
I don't know, Megan, if you have anything to add, because you and I've done this, we've published and we've created some interesting things, but we've also published about them.
Yeah, no, and I think that's it. I mean, that's where we are. We've been talking about knowledge translation, knowledge mobilization, but what does it look like? And I mean, you have so many awesome examples, and now Lindsay, you're getting involved, and it can just look so different in so many ways. So I think it is that creativity that lots of nurses have, obviously, and just really getting involved. So it is that transfer of our knowledge and our experience and our research. All of those pieces are just so connected, and absolutely it has to. We can't, just listening to what you're saying, we can't just deliver the findings and have someone else do it. I think we need to be involved like all the way along. And even when it's done, I mean, taking that out to workshops. So how do you use it once you've created it? So it's really complex, but so exciting because it is so embedded in research and practice and evidence. So I'm not sure if anyone else in the audience has other comments or ideas, because even just thinking about JBI, so for those of you who have done that, JBI started out as systematic review, and that's really what they were focusing on. But over the last 5 or so years, they're really pushing the so what, like what is it that we can do to make a difference? So I don't know what they talk about like KT, but it is about making a difference and knowledge translation. I think, you know, that is the main focus of it, beyond the shelf.
Yeah.
But yeah, anything else from anybody? Oh, there's might be something in the chat. Sorry, I have to kind of go back and forth.
No, it's just thank yous.
Great. Good. So anything else, Lindsay or Sheri?
I'm good. Thanks, Lindsay.
So
Thank
thank
you,
you so
everyone.
much for your presentations and lively conversation. And we will be posting this online. And of course, we will be looking forward to more results and your publication. We need to get that out to all of us so we can look at that.
Thanks
Thank
for
you.
sharing.
Thanks, everybody.
Bye.
Great.